Hello everyone, this is Dr. Deepthi Variku, HOD Department of Physiotherapy, Dolphin PD Institute of Biomedical and Natural Sciences. I welcome you all in this online lecture series on our add-on program, add-on certificate program on taping techniques. This program will be conducted for 6 days, in which we will have this program in hybrid mode where we will be having both online and offline classes. So, continuing with the lecture, today's topic is Introduction to Taping. So, first of all, taping is used as one of the means of rehabilitation or prophylaxis in instances where support and stability are needed. As a first aid tool for the prevention of injury and protection of an injured anatomical structure while healing is taking place. The creators of the taping also state that the tape is able to improve blood and lymphatic circulation, reduce pain, realign joints, and reduce muscle tension. Prophylactic use of tape is to prevent supporting injuries, mainly the sports injuries, and has also been reported that it is very effective in sports rehabilitation. Regarding this, you will have a separate class on taping in sports. Now, moving towards the uses of tape. First, we want to provide protection and support to the joint while permitting optimal functional movements. We want to reinforce ligaments and restricting unwanted movements. By providing protection and support to the joint, we are permitting optimal functions as you can see in the first line. In the second line, taping may have proprioceptive influences as you see in the third point. Proprioception is your body's ability to sense its movements, locations, and actions. A number of studies have reported that training to improve proprioception sense using kinesiotaping improves body's balance and walking abilities. In addition to that, it also is very helpful in compressing the recent injuries, reducing the bleeding and swelling, allowing optimal healing with stressing the injured structures without stressing the injured structures. Change in latency time might be due to result of cutaneous stimulation. Now, what are the effects of taping? So, taping effects could be divided into three. First, the mechanical effects, then neuromuscular effect, and then the psychological effect. Mechanical effect, the method of applying tape often involves stretch, compression, or shear forces. Though the skin and underlying tissue, this although skin and underlying tissue are absorbing this force, but this shear force goes through the skin towards the underlying tissues. Taping with tension increases the threshold of pressure pain perception. Therefore, stretch and compression caused by rigid tape with tension could disturb the nociceptive signal transmission and alter pain perception. This taping with stretch produces immediate mechanical correction of your posture as well. In regarding the neuromuscular effects, the tape can be used for neuromuscular re-education. Recent research suggests a beneficial effect of neuromuscular taping on postural control, balance, or proprioception by stimulating mechanoreceptors. As reported in two case studies, this application seems to be promising in clinic to improve gait strategy in patients with joint hypermobility syndrome like ED syndromes, and then also improves upper limb movement in patients with cerebral palsy. Regarding psychological effects, the research states that taping improves support and reassurance regardless of whether the area is injured. Another potential advantage of using taping or bracing is an increased sense of confidence, stability, and reassurance that the individual may experience when performing a dynamic balance activity. Now, let us see what are the uses of taping. We can use tape to relieve pain, improve stability, enhance athletic confidence, reduce joint recurrence, prevent injury, correct faulty biomechanics, inhibit muscle action, facilitate both. It can be used in both, inhibit the muscle action also and facilitate the muscle action also, depending on what is the need for the patient, what is the need of the taping for the patient. It also is helpful to enhance proprioception. It compress in the presence of edema or lymphatic drainage. It can give compression and be beneficial. What are the goals of taping? So taping goals could be prophylactic, rehabilitative, functional, and corrective. Prophylactic are in order to prevent injuries from happening. Rehabilitative are to the treatment of injured musculoskeletal body parts by restricting movements during healing process. Functional are mainly to help the person or athlete maintain day to day activities, functional body movements while still recovering from the injury. And corrective to reduce deformity by reducing movement and facilitating opposite directional movements. Now, let us have a look towards the types of taping. So, first we will see types of taping. Mainly, first divides will depend on good quality tape. Tape should be always of good quality and should adhere readily and maintain adhesion despite any perspiration and activity. So, first tape is elastic adhesive bandage (EAB), stretch adhesive bandages. This tape offers elasticity as well as adhesion, useful for a wide range of purposes. Maintaining localized compression over a contusion keeps maximal pressure over an injured area without compressing circulation, forming an anchor around a muscle area and keeping a brace in place. So, what are the quality characteristics of this kind of tape? It has strong recoil power. To test, stretch an 80 centimeter strip to maximal length, hold for 30 seconds and then release it. Tape should return to 25% of original length. Ideally, the roll should be encased in airtight wrapping to maintain freshness. Strap tape will not give mechanical support to ligaments but may be used in conjunction with rigid tape to give added support. Stretch tape is not normally tearable and must be cut with scissors, but there are now available some of them are available in very lightweight categories also. Stretch tape is available in a variety of widths from 1.2 to 10 centimeters and sometimes even wider also. Stretch tape may have one-way stretch in length or width, two-way stretch in length and width both. So, stretch tape tends to roll back on itself as you cut. Therefore, it is wise to allow the last couple of centimeters to recoil before sticking it down. Next are non stretch adhesive tapes. These are zinc oxide tapes mainly, adhesive, non elastic, and available in rolls of various lengths. They are slightly porous to permit some lateral glide or stretch, like shear forces across the bias of the tape. Non-stretch adhesive tape has a non-yielding cloth baking and is used for the following: to support the inherent structures like ligament, capsule, etc., to limit joint movement, to act prophylactically, to secure the ends of stretch tape, to reinforce the stretch tape, to enhance the proprioception. Non-stretch tape should be torn by hand to maintain tension during application. It is important to be able to tear the tape from various positions. So we have to practice it. Practice will help to attain a high level of efficacy in these tapes. Now, next is you can see the hypoallergic tapes. Hypoallergic tapes offer an alternative to conventional zinc oxide adhesive tapes to which some athletes are allergic. This tape is primarily promoted for holding dressing in place. However, it also makes an excellent anchor when combined with adhesive spray, especially when encircling the whole limb is impractical or contraindicated. In such cases, it can be used instead of non elastic zinc oxide tape or elastic adhesive bandage. For many tapers, it is the tape of choice as an anchor in unloading, like some facial elements. Okay, it is highly porous and allows skin to breathe. Next are the waterproof tapes. They are also available in many widths. The tape, medical grade adhesive, is also water resistant and strong enough to stay on for 3 to 5 days, even while you work out or take showers. Next are the cohesive bandages. Cohesive bandage is generally used for quick fixes, such as applying a compression bandage to limited swelling within a joint, to secure sock and shin guards when playing football, protecting goalkeepers' fingers and wrists from hyperextension. They are useful product and may be used instead of stretch tape. The product sticks to itself and not to the skin. It is waterproof and is reusable. There are most they are These are most useful when applying spica bandages or as a cover up for any other taping procedures. Now the most important, what we are using nowadays a lot, that is the kinesio tape. Kinesio tape allows longitudinal stretch of 55 to 60%. Method is therapeutic taping technique which alleviates pain and facilitates lymphatic drainage by microscopically lifting the skin. This lift affects forms convulsions in the skin, increasing interstitial space and allowing for decreased inflammation in the affected area. Kinesio tape contains either 100% cotton and elastic fibers, or it can be a blend of polyester and cotton with elastic fibers. The latter is preferable choice of kinesio taping application on a sensitive skin when higher tensions on the tape are needed for the desired outcome. The tape does not spread horizontally. Its elastic quality stays good for 3 to 5 days. It has got polymer cotton strands, that is why I told you the skin could perspire through your kinesio tape. Now the target tissue should be elongated prior to the tape application, so we can have various amounts of stretch on the tape can be used, like ultra light where we use 0 to 5% for epidermis, then super light where we use 5 to 10% for dermis, paper off when we use 10 to 15% for superficial fascia, moderate where we use 25 to 50% for deep fascia, severe where we use 75% for tendons, and full where we use 100% for the ligaments. Upon removal, no glue residual could be seen on the skin. That is one more important thing of the kinesio tape. Then another tapes are like Mulligan taping. Mulligan concept was initially developed by Brian Mulligan from New Zealand. It is now recognized worldwide in manual therapy approaches. His concept of mobilization with movement, that we called as MWM, is the application of manually applied accessory joint glides with concomitant pain-free active movements. Now, taping is applied in Mulligan taping in various directions that complement the applied MWM passive force to the joint or the soft tissue where it is applied. Taping can be used as a part of the treatment and may be used for a week or two while the joint mobilizations are applied, still during therapy or while following a prescribed home exercise program. Mulligan taping has been shown to be effective in reducing pain in PFPS, improving balance in gait in subacute stroke patients. Next is the McConnell taping. Patellar taping was originally developed by Jenny McConnell and is a simple, inexpensive self management strategy. The aim is to create a mechanical realignment of the patella in the intertrochlear groove and reduce pain. Although patellar taping seems to reduce pain and improve performance of individuals with PFPS, the exact mechanism of these phenomena cannot be explained still. Now, what are the basic principles of applying taping? First, we have to make sure that the patient is comfortable while we apply. Second, the application should be very proper. We have to make sure that application is done in a proper and designed and full evidenced manner. Protection of the skin is very important, and then proper removal is very, very important. Do not give scars to the patient while removing the tape. Now, what are the prerequisites for taping? What are the things which we have to manage while giving the taping or before giving the taping? First of all, what is very important is that selection of the tape is depending on the patient's diagnosis. This we have to make sure that we always keep in mind. The patient should feel that the tape application is comfortable. If he feels it is uncomfortable or irritable or restricting his activities of daily living, then we have to reconsider the application of the taping. So we should be familiar about the taping. We should visualize the purpose for which tape is to be applied. We should be very familiar about the technique we are using, and we should have all the suitable materials in hand before we give the taping. Now, what are how can we select the tape? So there are some personal preferences for selection of the tape. Second, the patient's preferences. Third, the disease preferences, and then selection of the tape. Patients, athletes acceptances. Sometimes few athletes will come to you saying that we don't use this tape, we are allergic to this, we don't use this tape, we are allergic to the XYZ tapes. At that time, you have to make sure that you take athletes acceptance and athletes preference in first in your mind before selecting the tape. Then, what is the underlying disease? That is very important. Then, personal preferences. Personal preferences will depend on personal experiences. Second, which kind of tape and material are you comfortable handling? What works best for the clientage that you cater to? And then the feedback. Feedback and follow up sessions also play very important in selection of the tape. Judgment, ultimately, it is the therapist's judgment backed by sound knowledge and experience that is the best criteria to decide the tape and technique of the particular patient. Next is tape selection. Tape selection will mainly depend on size and type of the tape. The tape is selected depending on the area, the body part to be treated. Narrower tape is usually used for small joints, and larger, the higher width of width tape is used for the larger joint areas. Depending on the condition and recruitment functional demands of the patient, we will decide which type of tape we have to use and what quality we are going to use. Now, coming to application, first of all, have all the required materials at hand. You can see in the diagram also, the picture also. All required materials for taping should be there in the vicinity of your hand reach. And then have the athlete or your client be comfortable and in comfortable position. Apply the tape to skin at room temperature and have full attention to the athlete. It is very important. We have to make sure that we maintain few things like clean the area first with a gentle liquid antiseptic soap or antiseptic soaped gauze, and then gently dry the gauze, use adhesive spray, wipe with rubbing alcohol soaked gauze. If there are any hairy parts over the area, shave area to be taped, apply antiseptic lotion, swab dry with gauze, use a skin toughener if skin is not irritated. Or if it is irritated, use any antibiotic ointment, apply lubricant sprays, and using protective padding over the area. Under wraps could be also used if the patient is very much allergic to the tapes. Okay. Use correct type and width and amount of tape. Apply strips of the tape in a sequential order. Remember, you have to apply tape in a sequential order. Overlapping of the successive tapes over each other may cause adherence or constriction to the blood flow also. So overlapping successive strips should be always by half to prevent slippage and giving gapping. Apply each strip with a particular purpose in mind. Apply tape smoothly and firmly. Follow with the shape of the limb. Explain the function of the tape to the athlete and how it should feel. On completion, please check that the tape is functional and comfortable and the patient is able to perform all the activities properly. Quality control is very important. For quality control, you have to choose the correct tape for specific taping job. depending on the actual structures involved and whether the taping job involves padding, support, restraint, or compression. In general, elastic tape is used for contractile tissues. Remember this. Elastic tape is used for contractile tissue injuries. Elastic tape is preferable in these instances because it gives stretch with support and a graduated resistance, and yet limits full stretch of the muscle or tendon. Non elastic tape is used to support injuries of non contractile structures like ligaments. Non elastic tape reinforces the joints in the same way the ligaments would, thereby increasing the joint stability. Then, application of tape is also very important. The person applying the tape to the injured area or the affected area must modify the application depending on the need of the patient. As long as the tape application is fulfilling the goal of the supporting or protecting the target area without putting other structures at risk, it is valid. Okay. You have to make sure that uh, you monitor, you progress with these points, like, is effective compression being maintained, is the tape adhered properly, is the injured structure being properly supported, are the supporting strips and anchor points adequately tight. So, some precautions have to be made while you apply tape, like excessive traction of skin should not be there. There should not be breakage of skin, wrinkles or gaps in between the strips, blisters. Patient should not come with blisters next day. And then I told you continuous circumferential taping would hinder your circulation. Single strip produces a more uniform pressure. Okay. Excessive layers of taping should be properly maintained if you are using excessive layers. Otherwise, 1.5 distance, after half distance only the layering should be there. Okay. Too tight application may give you aches, so avoid these things. Now, what are the post tape cares? So, while you are giving taping, make sure that you check these things. First, there should not be numbness in the distal parts, tingling in the distal parts. The force should not be that much excessive that the patient feels dislocation. Or after application of the tape, please check the distal pulse. Pulse should be there. If any loss of pulsation is there, it is a red flag. Loss of function, it is a red flag. Numbness, tingling, these all are red flags. You have to remove the taping ASAP. Now, removal of the tape. Never rip tape off, especially from the plantar aspect of the foot or any area. Use tape cutter or bandages, scissors for safe and fast removal. Lubricate the tip with petroleum jelly and slide it parallel to the skin in the natural soft tissue channels. Remove the tape carefully by peeling it back on itself and pushing the skin away from the tape gently. Pull the tape carefully along the axis of the limb. Check the skin for damage and apply lotion to restore skin moisture. Tape should not be left on more than 24 hours unless using hypoallergic tape, which may be left for longer. Leaving tape on for too long period may lead to skin breakdown. If allergic reactions occur, stop using the same tape immediately. Protect the whole area with underwrap to make sure that the tape does not contact the skin if the patient is too sensitive. Refer the athlete to medical doctor if you see any erosions or bad reactions. Athlete who cannot use tape or tough skin spray should consider prophylactic bracing. Always check the skin for damage and always apply the moisturizer. Now, how to store these tapes? Zinc oxide tapes are sensitive to temperature. Okay, so they are susceptible to temperature change and should be stored in cool place. Tape should be left in its original packing until required. Partially used rolls should be kept in airtight containers and not left on shelves. At temperature at over 20 degrees, the adhesive mass becomes sticky, making the tension stronger and thus more difficult to unwind. Non-stretch tape is also more difficult to tear when warm. Hypoallergic tapes are not susceptible to temperature change. Now, let us see some taping terminologies which we will have to face while we are applying taping in coming sessions. first is anchor. Anchor is the first strip of tape applied over the below, over, above, and below the taping side. Okay. The first tape, they may be non-elastic or elastic depending on the expansion requirements of underlying structures. The main purpose is to form a base for subsequent supporting strips of the tape. How can we apply this? Place these strips around the circumference of the limb to be supported above and below the injury. They must be placed directly on the skin and they must follow the natural anatomical contour for optimal adherence. Anchors minimize traction on the skin and are applied without tension. Here you can see in the first picture, this is the open non-elastic tape anchor placed on the distal part of the lower extremity and over the calf. This is the elastic tape anchor over the underwrap. This translucent is the underlap, and then these are the two anchors placed over it. Next are the stirrups. These are a loop of non-elastic tapes. This could be horizontal, vertical, reinforcing locks. They are actually locks. You can place them from the distal to proximal anchors to lock the anchors. These are the stirrups. So they are mainly to directly support an injured ligament and to support the joint. Here you can see the different stirrups we are playing. Okay. So attaching one end to the anchor, place the tape so that a lateral and medial component lends stability. Pull the tape tighter on the injured side and attach firmly to another anchor. Apply tension to the tape over the injured structure and affix the tape stirrup to the proximal anchor. Here you can see. First you can see is a Gibney horizontal strip which adds stability to the joint. You can see we are applying it another and it gives a tension. Horizontal stirrup. Then you can see we give a reinforcing strip which restricts the movement and adds tensile strength to the strategic area when applied over the stretch tape. There are other types of these stirrups also, like butterfly or check reins, a combination of 3 or more vertical straps applied at angles of between 10 to 45 degrees to each other, placed at the axis of rotation of the joint to be taped. These stirrups can be of either non-elastic or elastic tape depending on the injured structure and the goal of the taping. The purpose is mainly to restrict movement in more than a simple uniplanar direction as so often found in normal motion. This butterfly or check reins can resist stresses with inherent torsion components as well as those that are purely unidirectional. Here you can see these are the vertical stirrups you can see we are applying. This may maintain the contact over the origin of tape stirrup at the anchor while applying tension. If we apply it like in butterfly shape, we call them as butterfly stirrups. Then are the lock stirrups. A non-elastic tape stirrup attached firmly to the underlying tape, reinforcing stabilization of the injured structure. The main purpose is to reinforce stability of the subtalar joint or other foot joints and the talocrural mainly, okay, and allowing the functional movement at that time. The method is mainly to give strong tension applied at specific points in the application to reinforce the tape joint, to ensure that the selected ranges of motion are limited at end of the range of motion to avoid overstressing of the injured structure. These secure the cut end of the stretch tape to roll back on and secure check reins in place and neatly finish the technique when applied over the anchors. So we apply them over the anchors again to check the reins itself. Now, what are the check reins? That comes the main question. So, the check reins are mainly restrict the range of motion. Whenever we are applying a check rein, we try to restrict the range of motion. This is the step for check reins. You can see first, in a truly vertical position from distal anchor to the proximal anchor, we will apply them. Then, secondly, in a light rotated manner from the distal to proximal anchor. Thirdly, in the same but in opposite direction, like once in this direction, next time in this direction. And finally, re-anchor these stirrups to hold the check reins in place. Now, what are the heel locks? These give additional support to the subtalar and ankle joints where we lock the heel. Here you can see first we start from the medial part, and then in a figure of 8 manner we cross the heel and come back from the palmar to dorsal aspect and cover it. So these are the heel locks. These are figure of 8 heel locks, a strip of non-elastic tape forming a figure of 8, usually applied as one of the last stirrups in ankle or thumb taping. Actually, they mainly add stability to cover any remaining open areas or tape ends to close the tape application neatly. So we have to apply them very neatly in encircling one segment of the limb in another circle and covering the area nicely. This is how figure of 8 taping to thumb or to ankle is done. So we will first start with the medial part, go towards the plantar aspect, come over the dorsal aspect, cover the ankle joint from the medial part, cover the ankle joint from the lateral part, and then refix the stirrup. Now, compression stirrups. These are elastic adhesive tape stirrups applied with localized compression over a muscle injury. The main purpose is to provide ample compression forces localized to the injured area without compromising circulation. Limit swelling, decrease the chances of further damage to the injured site, and allow continued activity. So here you can see the compression strips, how they are given in a vertical manner and in a horizontal manner. You have to apply one layer of elastic adhesive tape directly to the skin of the injured area, okay, with minimal tension from distal, can see, to the proximal part. Apply pressure strips by pulling the tape in opposite directions until fully stretched, and then apply directly over the injured site, covering about 50% of the limb circumference. Maintain the pressure and gradually release the tape to ensure over the injured site. Continue around the limb without tension until the end overlaps. So this is how we will do compression strips. Then the closing up strips. They cover any remaining open areas or tape ends, neatly finishing the tape job. So lightly placed strips of elastic or non-elastic tape which cover the remaining area. Main purpose is to reduce the risk of skin blisters by covering all open areas. It also makes the tape job less likely to unravel during sporting activities. Lightly apply the strip of tape around the circumference of the limb with one hand to one half width of the overlap. Here you can see this is the first part where this area is left and these are the areas left, and then we will apply the closing strips over the areas. Now there are some additional terminologies, like first we can see under wrap or pro wrap. These are thin polyurethane foam material used to protect sensitive skin from zinc oxide adhesive mass. Then we have gauze squares. These are foam squares or heel and lace pads. They are used to protect areas which are susceptible to stress and friction. Then there are padding. They are felt foam, rubber, or other material to protect sensitive areas. Then we have adhesive or deadhesive sprays applied to make skin tacky and thus help under wrap, protect pads, or tape adhere more readily. Then we have tape removals which clean the glue residues. Then we can also have deadhesive sprays. They break down the adhesive mass and allows tape to be removed easily. Then petroleum jelly, they are applied to lubricate areas of stress and reduce friction and irritation to the soft tissues. You can use talcum powder mainly to remove adhesive residual where necessary, and it also prevents stretch tape from rolling at the edges. Then we have cohesive bandage which adheres to itself but not to the skin and can be used for light compression or applied over tape to prevent unraveling in water. Then tubular bandages, and these bandages are very important. these tubular bandages may be applied over completed tape job to help set the tape and hold it place. Then elastic bandages used for compression and for traditional spicas. Cloth wrap used for ankle wraps, triangle bandages, collars, scuff support. Then we also need tape cutter. Tape cutter is used for mainly allows quick and safe removal of the tape. Then we have bandage scissors, flat ended scissors for safe removal of the tape. Let's have a quick look towards how to cut the tapes. First, we can have it in different patterns. First, you see here this one. This is called as eye strip, where we cut the tape from one part and another part. The only thing we have to make sure that the edges should be round. Edges should not be angular. The edges should be always round. So this is the basic used to support the muscles, tendons and ligaments, where we have only one proper cut strip. It is called as eye strip. Then if we have one eye strip and then cut it from in middle, have a scissor cut from in middle and then make the edges round and pull one part of the strip towards one side and another towards another side, we will have a Y stirrup. Y stirrup is mainly to control position of the specific areas. You can see Y strip, it is of Y shape, so we call it as Y. We can have two angular pulls with a Y stirrup. Then if we cut one eye strip from proximal part and from the distal part towards the midline, towards the middle, and then have four sided angular pulls, we will have an X strip. It covers larger area and it crosses multiple joints and can be mainly used at your back. This is the X strip. Then we have fan shaped strips mainly used for multipennate muscles like deltoid and all, where we can also use it to control the swelling. Now one eye strip, again I am telling, make the edges round. Edges should not be angular. Make the edges round and then give 3 strips by the scissor. And to all the directions of pull, you can pull the stirrups and have a fan shape stirrup. So we have I stirrup, Y stirrup, X stirrup and a fan shape stirrup. So this is about the introduction towards the taping. If anyone of you have any doubt or want to ask any question regarding the uses of taping, regarding the types of taping and some terminologies, you can call me. I can give you my number. You can call me or you can drop an email or WhatsApp. Your all queries will be answered. If anyone has any query, you can ask me. You will be answered. All the queries will be answered. Thank you so much. Thank you so much. Let us all meet in the next class. Thank you.